And as the nation confronts this COVID surge during the holiday travel season, a new possibility hanging over future flights, President Biden now says he would impose vaccine requirements for domestic travel if his medical team recommends it. A short time ago, the president's chief medical advisor appeared to tip his hand a little bit. Take a listen.
Everything that is an intervention is always on the table and always discussed. And we discuss it regularly. Right now, we feel that the masking requirement and the degree of filtration on a plane is sufficient to keep people safe.
And joining me now is the international president of the Association of Flight Attendants Union, Sara Nelson. Sara, great to see you. Thanks for making time today. I just first want to see if your members support a mandate on travelers to protect flight attendants and other crew members.
Well, overwhelmingly, the majority of our members are saying that they would like to see this. And so we have been very clear that we should be doing everything we can to get people vaccinated and to encourage people to do that. This is maybe one more way to do that. I do want to be really clear, though, that right now there's not really an operational way to get this done. So it would take a lot of work by government and airlines working in coordination to be able to determine someone's vaccination status quickly to make sure that the operation can continue and this wouldn't just create a meltdown like we're seeing over the holidays.
Yeah, and you heard what Dr. Fauci said. Do you think that this is something that the administration is actually seriously considering, that this could in fact happen?
I continue to hear that this is on the table. The airlines have spoken out and been against this because of their operational concerns. But I think, you know, we're a nation of problem solvers, and when we actually decide that we want to solve problems, we can do it. So it's too important to get everyone vaccinated and to keep everyone safe. And frankly, this is an issue of safety in our workplace. And that's why we'd like to see a real effort here to see if we can get this done.
And does it come down to a federal mandate in your mind? Because in theory, individual airlines could choose to do this, I suppose, as well. But is it going to take, do you think, it coming down from the federal government to make it happen?
I think it's really important that we have consistency across the industry, and that will require a federal mandate for that. It would be very difficult for individual airlines to put this in place, because we all use the same security lines, we all use the same infrastructure at the airports, and to have different policies with each of these airlines with what people need to bring, it would create mass confusion and make travel much more difficult for people. So that's why there has to be a consistent policy across the board.
Right, to really streamline it and make it uniform. I know you've been critical of the administration's policies and question whether corporate clout was perhaps driving some decisions like shortening the quarantine guidance. I want to listen to what the CDC director, Rochelle Walensky, said this morning. This was her defending that decision to reduce that from 10 days to 5. Take a listen.
Many of those cases are mildly symptomatic, if not asymptomatic, and especially among those who are vaccinated and unvaccinated. And then finally, the behavioral science. What will people actually do when people need to get back to work? What is it that they will actually do? And if we can get them to isolate, we do want to make sure that they're isolating in those first 5 days when they're maximally infectious.
So from what you're saying, it sounds like this decision had just as much to do with business as it did with the science.
Well, so it really had a lot to do with what we thought people would be able to tolerate.
Right, what people would be willing to tolerate and willing to do. Sara, what do you make of her comments?
Well, I'm not sure who those people are that she's talking about would be willing to tolerate. The people on the front lines who've been dealing with this pandemic for 2 years have dealt with the stresses and strains and the real concerns from our families that we're going to bring this virus home to them. They are dealing with long COVID. They are dealing with other medical emergencies where they're not able to get their loved ones into hospital beds because our hospitals are full. So let's not make a decision now that may provide some relief right now that will have longer-term problems. What Director Walensky was saying there is that there's low chance. That's cold comfort for the people who know that now we're going to be going to work with more people who are infectious, because there will be people who are still infectious who are coming to our workplace, either workers or who are being forced to come back to work, frankly, because there's pressure from the airlines or other companies to get them back on the job to cover those shifts. Or we're going to have passengers who are coming because they have not tested. You know, the industry asked for breakthrough cases only and testing before people would come back at 5 days. It doesn't seem like we're even meeting the basic standards to have a level of comfort in this country. And we really need everyone around this country to have confidence in our public health officials. That is what has created conflict on our planes, because people don't know what to believe. And then flight attendants are left to deal with that and enforce safety measures that are sitting on very loose ground.
All right, Sara Nelson, thanks so much for your comments. We sure do appreciate it.
Thank you, Jessica.
Well,